Hello, my name is Alessandro Baronti, President of the Rigo RAM, and today I bring to you the training on Analyze, Implement, and Grow. Analyze, Implement, and Growth is going to give you a clear understanding on important KPI, key performance indicator to measure the success of your business. See, today running an optometric practice is getting more complicated than ever before because it's not just a medical environment, it's a combination between a medical and retail where 60% of your bottom line profitability today is driven by the retail segment of your business. So being a great doctor is not good enough anymore. You also have to evolve in becoming a great business person. During this training, you're going to learn that a dream is a vision with no plan. That brings a lot of idea, but since you don't have a plan, poor or non-implementation. Where a vision is actually a goal with a clear plan that brings idea that are going to be implemented and is going to result in growth. Enjoy the training. We're going to cover two important segments during the training of today. The first one is going to be key progress indicator, also known as key performance indicators. And then we're going to transition into the customer's lifetime, in our world also defined as a patient consumer. Okay, let's start with the first segment, key progress indicators. The key of knowing if your business is tracking in the right way is by analyzing KPIs. But what are the KPIs? That's the next big question, right? Sure, we all wanted to track the bottom line and really bring and deliver incremental sales. That's really the golden ticket. But we often get confused about what do I track, how do I actually analyze. So in our business, it's relevant to have a very clear idea about first and foremost capture rate. You should know right away where the capture rate in your practice is. You should also know the cost of your chair time along with the profitability of your chair time. You should know the percentage of multiple pairs. You should know the percentage of sunglasses that you're selling plano and prescription. You should know the average dollar transition of a frame sales. And you should also know the average dollar transition of a frame and lenses sales combined together. And so much more along with that. So let's analyze the aspect of measuring KPI and why this factor is so relevant as to a successful business. It's going to be very easy for you to really have clear visibility on the difference that the monitor of this KPI is going to bring to the profitability of your business. The first rule is actually to create a benchmark. So it's very important to measure your KPI for the last 12 revolving mounts. So I'll give you an example. Let's say that we're measuring the capture rate, and let's say in the last 12 revolving mount, the average of your capture rate was tracking at 45%. Now you're implementing changes in your practice effective today to be able to affect the capture rate, and you're going to monitor your result from today on for the next 30 days. And you're going to discover that in this 30 days period, all of a sudden your capture rate is actually growing from 45% to 47%. Now the comparison of that figure, that 2% increase, is actually giving you a very clear indication that the changes that you apply to your business are actually working. And now you keep tracking and you keep improving by keep measuring those KPI. It's very important that you assign to yourself and your team a realistic expectation. It's going to be very demoralizing if you say to your team, folks, our capture rate today is 45%, is not acceptable, we're going to increase it to 65%. It's almost impossible to go from a 45 to a 65% overnight. So put realistic goal to gradually grow your KPI so you keep the morale of the staff at the high level, you stay engaged, and then all of a sudden you keep the profit of your practice going up and up and up, one step at a time. One of the questions that many doctors ask me is my practice big enough? Do I dedicate enough square footage both to my medical or the retail side of my business? Do I have enough staff to be able to support my business? Well, to help you to answer this important question, I'm going to discuss with you sales per square foot. This KPI measures the amount of revenue generated on average for each foot of retail space and medical space in your practice. Sales per square foot equals total revenue divided by total floor area. This is a popular metric for store owners, for practitioners like you, who wants a clear perspective when evaluating rent cost or redesigning the complete layout of a practice. It is the ultimate indicator of how effective your practice layout and sales associated are in positioning your product. And it helps in deciding whether or not to downsize, relocate, upgrade, or change the configuration of your practice space. I'll give you an example. What I shared with you before was that today in an optometric practice, 60% of your business comes or should come from the retail segment of your practice. The average capture rate in the United States is 65%. That means that 1 every 3 of your patients is coming to see you for your medical service, but they actually walk in and you're not converting them in a patient consumer, giving you additional profitability. So the question for you is, what is the percentage of the square footage today in your practice that you have dedicated to retail? What is your capture rate? What are the things that you're going to do and implement to be able to increase the capture rate? Maybe one of the techniques in this case is that to pay more attention to the retail side of your business, maybe to dedicate more square footage to the retail side of your business, maybe to hire more people working in the retail side of your business. So analyzing the sales per square foot is going to give a precise idea on the topics that we discussed so far. A lot of practitioners ask me the question of, is my practice profitable? I have a dilemma. I'm doing $1 million with my practice, but at the end of the month, I cannot figure out if and how successful my operation is. This is a great question because having $1 million practice doesn't mean that you have a successful practice, and it may be meaning that you have a successful medical practice, but probably you don't have a very successful retail operation attached to your medical practice, or vice versa. So the two of them are really, the two businesses are really connected together. And it's very important to have, for you to have a full understanding on how the two sides of your business are actually performing. For that reason, it's relevant for you to have a P&L on the medical side of your business and also a P&L on the retail side of your business. When it comes to medical, there are important KPI that you need to measure very carefully. The first KPI is related to the chair time cost. How much is that costing you for you to put that patient in that chair every single day? So how do you actually figure that out? Well, you take the numbers of appointments that you can actually generate in your practice based on the numbers of doctors that you have, based on the exam lane that you have. You actually divide that specific number to all of your overhead costs to actually be able to run your practice, and that will spill out the final number. And you're going to see that if you are in the average, you're going to be between $120 to $160 per patient to be able to position that patient in the chair. It depends on the size of your practice. It depends on if you own versus renting the building. and many other factors combined together. Now, after you figure out that number, so now you know that every single time that you have an open appointment, that you have a no-show, you know exactly how much that no-show, that open chair is going to cost you. Now go into understanding what is the actual profit. How much money am I making every time that I sit down a patient in that specific chair? So you actually look at all of the potential eye examination that you can actually do in your practice, and you divide that with the overall profitability of your practice after you remove all of the cost, of course, and that will give you the net numbers. So now you actually know what kind of revenues you can actually make every single time you position a patient in that chair. Now tell me, if after you know these two numbers, if you're not going to be very motivated in the morning or at the end of the week when you have your meeting with your staff to discuss no-show, numbers of appointments that we need to have every single day, how to trade up in a visual managed care environment, and all of those kind of important type of information that you need to review with your staff. It's also relevant for you to measure the medical service profit per square foot in your medical in the medical side of your business. You get that number by taking the total revenue and dividing that numbers by the total the total square footage of the floor area that is actually dedicated to the medical in your specific practice. Now you have a better understanding about the P&L of your medical side. Now let's move into the retail part of your business. You take the same formula, the sales for square foot in the retail side of your business. You take the total revenue. Now you divide the total revenue by the total floor area, the square footage dedicated to the retail part of your business. Now you're going to have a specific value on how much money each square foot generates in your actual practice, both in the medical and the retail side of your business. When you have visibility to these kind of numbers, now you can make intelligent evaluation of do I want to downsize? Do I want to upgrade? Do I want to relocate? And these are the decisions that are going to be founded on numbers, on statistics. So you actually remove the emotion and you take a very analytical approach about the business. So the suggestion is carefully analyze the P&L of the medical part of your business and the P&L of the retail part of your business. Measuring foot traffic is a huge insight to really measure the success of your practice and to measure the success of the implementation of the system and the procedure that you have in place to run your practice. When we're looking at foot traffic, it's not only a result of the scheduled appointment that you have in your practice. It's also referring to new patient and consumers acquisition, which can happen remotely by that specific customer that is actually calling in to schedule an appointment, and then you ask them, how did you find out about us? Oh, I just saw a social media campaign that it was talking about you guys, or I just saw an advertising, or I was just driving by and I saw the amazing window display that you actually have, and or I saw through the window that you had that brand that I was actually looking for and I could not find anywhere, so I decided to actually make an appointment. So that's a patient consumers acquisition that you have done by actually implementing a strategy. It can also be that patient that is actually walking by and driving by and they decided all of a sudden to stop by and see you. They're walking in to come and see the doctor to schedule an appointment. How did you find out about us? By actually asking the question, you measure those strategies that are actually working effectively for you, and then you start to leverage on reinforcing the investment on those specific strategy. So foot traffic is a combination of a existing eye examination, and now all of a sudden you can look at the effectiveness of your patient recall strategy or the effectiveness on which you manage the schedules of the doctor to maximize the utilization of the chair time. That part combined to new patient consumers acquisition in the way that I explained before. Sales per hour is a very helpful tool to measure when reviewing staff-related overhead cost. Calculating this KPI will really help you to understand how much revenue your employee contributes to each business, and on average by dividing your total revenue by the numbers of employee. So that will give you SPH equal total revenue divided by numbers of employee hours. This metric is especially helpful in understanding how hiring or firing employee and how that may improve or endangers the health of your business, because it can be overstaffed, but you can also be at the same time understaffed. Measuring SPH can also suggest employee efficiency and profitability, as well as how the revenue of different practice location may be affected by the size of the staff. It's also helpful in understanding how the tools and technology you have implemented to support your practice are actually working in terms of increasing or decreasing the cost of your sales per hour. And this is the hot topic now, the capture rate. And wow, so let's look at some information together to really understand finally and once and for all what capture rate really means and where you should be really if you want to have a successful practice. So capture rate is the equivalent of patient traffic versus total purchase minus medical routine follow-up. So let me give you an example of that. Total medical examination, when it comes to comprehensive eye examination, the comparison of how many of those patients that go through a medical examination and they're actually buying a material. I'll give you an example. A contact lenses patient that is actually buying an annual supply of contact lenses, and even better, they're buying the annual supply of contact lenses, and on the top of that, a pair of plano sunglasses with the UV 400. Or a patient that is doing a comprehensive eye examination that is now going to the optical dispensary, and they actually decided to buy, because of the eye examination, a pair of glasses, or even better, more than one pair of glasses. Minus routine follow-up. As an optometrist, as a practitioner, you have a complete dedication to medicalization of optometry, and a strong segment of your practice is built on that. When you see a patient that is coming to you for a comprehensive eye examination, you may discover a pathology during the comprehensive eye examination. Now it's going to become a medical condition. That patient may need to come back 3 or 4 times for follow-up. You only count that patient as one visit on the first time for the comprehensive eye examination. As you calculate the numbers of the capture rate, obviously you do not include the follow-up eye examination to really be able to check on the medical condition. So let's look at what is going on in the world, and let's compare to where you are in your own practice. Retailers have a conversion rate between 25 to 35% as retailers, not related to our industry, as retailers in general. That means that 100 consumers walk into a retail shop, In the best case scenario, since they clock each one of them in and out, in the best case scenario, they capture between 25 to 35 consumers. Online, a good website has a 1% capture rate. So 100 click, off of 100 click, only one person actually is making a purchase. So think about that. Independent eye care professional have an average of a 65% capture rate. Ophthalmologist optical has a conversion rate of 25% at best. Optical retailer, now we're in the world of optical, in retail though, have a conversion rate of 90%. So if you are at 65% today, you're considered average. I don't think any of you that are taking this training today decided to take this training because you want to be or become average. So now that you have an opportunity to understand where you are and put a strategy together at least to reach the level of optical retailer that is today set at 90%. Why would you give the opportunity to somebody else to fill the prescription of your patient? If your patients today are walking, you need to ask yourself the question, why are they walking? And then the next thing you need to do is, what are we going to do to prevent that from happening again? Average customers dwell time. Online analytics can measure how long a customer has browsed a website. But what about your practice? Discovering the fact that your patients are spending way too much time in your optical dispensary, combined with the fact that your capture rate may be super low, can be an early warning on many different factors, of which some of them may be the wrong inventory mix, maybe the wrong inventory level, maybe poor visual merchandising, maybe even related to poor service or poor education that your staff is actually providing to be able to entice that specific patient to engage with the product because of a need. And when you position a need, that need becomes a want. Or even poor storytelling to really be able to engage that specific patient consumers with an emotional connection with the product. So understand the system that you have in place. I suggest you to observe a patient journey, and most important, measure the dwell time so you can take a proactive instead of reactive type of approach. Okay, so now let's switch a gear and let's tackle the next important topic, which is customer lifetime. Customer's lifetime, it's about customer's loyalty. How long is that patient consumer is going to be loyal to you? Are they going to be make decision based on what the insurance is telling them? You have to go there because that's your new provider. Are they going to be making decision because they love you as a doctor? Are they going to be making decision that they love you as a doctor so they stay your patient, but they don't love your practice as a consumer, so they go buy merchandise somewhere else? A lot of people don't take it personal, it's business. No, I want you to take it personal because it is your business. 73% of consumers today use multiple channels during their shopping journey. And today, if in your practice you don't have a fully integrated omni-channel retail strategy, you're missing the boat and you're projecting your practice either in the past or in best case scenario in the present. If today you're operating in the present, you're already slow. If you operate in the past, you're toast. If you want to operate in the future, you want to be or become the next Apple Store type of concept, type of mindset in your community. You want to be perceived as the innovator. You want to be perceived as the practice that is not only in terms of state of the art of implementation of medical strategy, but you also want to be perceived as the innovative practice that has always the newest and the latest in terms of retail innovation and implementation. There is plenty of information about how to implement an omnichannel experience and why into implementing an omnichannel experience in one of the Derigo Ram presentation, which is called Creating an Experience. Streamline customer service operation. I strongly suggest you to place an important focus on your customer service operation and constantly look for new ways to optimize your process. And remember, your policy are just your policy, and do not be too stingy with the policy. Always stay focused on the customers. The customer's centric approach is important. You always want to give the impression to your customer that you're trying. People care to know that you're trying. Even if you cannot resolve the issue, as long as you show that you're going the extra mile to try to accommodate, that's important enough. And of course, I go back to what I said before. Also implementing omnichannel strategy as a solution, address the convenience factor, also allows you to focus on education throughout omnichannel type of digital solution. Integrate storefront technology. Nowadays, it is crucial for a practice to have a fully integrated omnichannel experience to offer to an evolving patient consumer expectation solution to offer a digital catalog to enable consumers to explore product both in a feel and touch way and also into a digital way, to be able to educate a consumers on different type of lens technology and product offering. More consumers today are shying away from visiting physical location, even in our industry. It is important for all of us to really start to think on ways to be able to provide a solution to an evolving patient consumers to really make that experience more fun, more dynamic, more interactive. Several leading organizations are utilizing today integrating omni-channel strategy. Let me give you an example of that. Apple. You can walk up into any Apple employee today and pay for the product right there on the spot. Each one of them is equipped with a portable device. And this makes it easy for you as a consumer as you're interacting in that type of process because all of a sudden you don't have to wait in line. You just hand your credit card to the associate, and as you're selecting the product that is coming to you, they can handle the entire transaction. By providing your team with this type of technology, now you find and develop a solution that is streamlining the entire process. And at the same time, you make this more effective for your staff, for your patient. You save time, and it creates a positive experience for the actual customers. This tends to lead to an overall increase in loyalty, in consumers' loyalty, and it can translate into establish a strong sense of dependency and really being able to invite that specific customers to come back and see you again because of what they felt throughout the entire experience. Fighting showrooming. Showrooming is a marketing terms that refers to when a customer that is in your practice is about to purchase an item from you, but suddenly they opt not to buy because they believe that there is a lower price available online. Obviously, they do not tell you that, and that translates in, you know what, I need to think about it, John, and can I have a copy of my prescription and then I will come back in a couple of days when I have more time, or John, I really need the opinion of my husband or my wife to really before I can actually make this selection. And let me think about it. Do you mind if I have a copy of my prescription? You're being shopped. When you hear this type of concept, you're being shopped, and most likely you're being shopped online. You can also observe the behavior of one of your patients if they pull up their phone and they snap pictures of your product on the board. You're also being shopped. Now, there is a way to actually turn this objection around and translate this into a complete positive by educating your patient on the reason why they should buy from you in your online store. I strongly suggest you to take the training, create an experience. I'm going to walk you through a clear example on how to integrate an omni-channel experience in your practice and how to overcome an online objection. Ultimately, if you can implement this system, this will drive consumers' loyalty up to the roof, and actually is going to give you an opportunity to really give an education to one of your patients and prevent them from having a bad experience as they will go to buy the product online if you don't do that, and consequently they will do that not being educated about all of the different negatives that they're going to experience. Ultimately, they will actually thank you for doing that. Enhance the buying experience. The general public will always flock to where they can get the best value for their dollars. I haven't said the best price. I said the best value. So what is value means? Value means quality, and means fair pricing, and means great product. And it also means, in a context of a service, great service combined to that. So now let's look at our practice and what we do in our own world. We provide a great medical service and you excel at that. So that builds value. We're supposed to provide a great retail experience. You excel at that. That builds value. You provide great product and that builds value, and you combine all of that with the excellent in the service, and that will give you patient consumers loyalty. In closing, I would like to cover the last step, which is empathize with the customer. A three-step approach that I would strongly consider you to implement. The first one is analyze previous purchase behavior of your patient consumers. That will give you the opportunity to prepare for the actual visit by understanding the lens technology that they embrace, the relevant fact based on the lifestyle form that you haven't addressed in the previous visit, and really be able to kind of take it from there, from the last visit. The other thing you may want to consider doing is create a suggested product offering. There are specific tools available in the marketplace today to create a customized approach to be able to do follow-up with your patient in preparation for the visit, to be able to provide to them product offering selection online on a wish list for them to view. And then the other thing is to really create a warm feeling as the patient is coming in for the visit, really create that team selling approach where as the patient is engaging with the product, is engaging with the experience, you actually seek for reinforcement or sign of consent on the selection of the product or the option by engaging your peers in the practice to be able to get suggestion and reinforcement. Thank you for attending today's training segment.